Let's just
Good
talk
morning.
about.
Thanks for having me on.
Let's talk about what's going on with mental health today. What are the proposals? What's going to change?
Well, today we're setting out the white paper on the future of the Mental Health Act. This is an act that's been in place since 1983. It's very out of date. For instance, it says if you're not married and you become incapacitated, the person who takes the decisions for you is your father. It needs to be brought into the modern age. I'm really pleased that even with all the challenges of COVID last year, we've been able to keep working on this new act. It's a manifesto commitment of ours to make sure that we bring it into the 21st century. There's been a huge amount of work led by Sir Simon Wesley, who's an expert in this area, and we'll be setting out the details of this new legislation to support people who are amongst the most vulnerable and to make sure that they're more empowered to be able to have a say over their own care.
And you'll know that there's a King's College London report out today talking about specifically mental health and intensive care staff, finding that half of them are suffering from serious anxiety, from PTSD, from problem drinking as well. There is no doubt, is there, that this is having a massive impact on mental health. What can you do to help that?
Well, absolutely. So whilst the legislation that I'm setting out today and the change of that, this is it's a generation since that's been updated. We've got to act in the here and now as well. So we're putting more funding in to support the people who have problems with their mental health in this very difficult time. And clearly there's pressures on mental health, but specifically we've also seen very, very big challenges amongst the NHS workforce, of course, because of the enormous pressures that they're under. But the thing is that there's something everybody can do about that, which is to stay at home and to follow the rules and to help to control the spread of the virus and therefore reduce the pressure that the NHS is under right now. So we're putting more funding in and we're supporting the front line of the NHS as much as we possibly can. But there's something that everybody can do to help to relieve the pressure that's on the NHS right now.
Let's talk about that pressure, because we're seeing over 1,000 deaths being reported a day, infection rates at over 50,000 a day as well. Is this the peak?
Well, I want it to be. But again, that comes down to the behaviour of everyone. You know, we've brought in this national lockdown. The rules are really simple, which is to stay at home unless you absolutely have to leave. You know, I'm at home this morning, whereas normally I'd prefer to come into the studio. And this is important. We don't say these things lightly. They are very important to try to get the number of cases coming down. And we know that this can work because we know that the only way that the virus spreads is when people meet each other or on surfaces. And so we can all play a part in making this happen. I know that I must sound like a broken record on that, but it's so important. It's true. And together we can make this the peak if enough people follow the rules, which are incredibly clear.
And just to go back to that question then, you said, I want to be really specific. Is this the peak? You're not sure that it is?
No, well, we don't know, of course. And, we publish the data every day. I hope that it is. But we watch it like a hawk. I mean, but the other thing is the way that, if you ask the question, is this the peak? It sounds to all of us like that's something external. The truth is that whether or not this is the peak of this winter wave of coronavirus is not external to us all. It's down to all of us, you, me, everybody watching this program. We can all do our bit. And so every time that you think, should I do that? Should I go out for this reason? Should I meet up with this person? It's those individual decisions all together that determine whether this virus continues to spread and continues to increase its spread. And so the stay-at-home message is there for the total clarity that the best thing everybody can do is to stay at home unless there's an unavoidable reason for having to leave.
And you've seen, we've all seen those pictures, haven't we, of ambulances waiting outside of hospitals. There is no doubt, and you indicated there, the pressure that the NHS is under, and many saying that the peak hospitals, for example, may be next month. Can the NHS cope? Will it be overwhelmed?
Well, we're going to do everything we possibly can to give the NHS the support, the resources it needs. That includes, for instance, opening the Nightingale hospitals. And the London Nightingale Hospital is now receiving patients for the first time since April. So we're giving the NHS everything that we can. And that's obviously necessary at the moment because there's over 30,000 people in hospital with coronavirus at the moment. But this is a big collective effort. One of the things about a pandemic is that whilst it has affected all of our lives, because of the restrictions that we've unfortunately had to put in place, the flip side of that is everybody can play their part.